Currently, I think there's a big challenging issue in India where we don't see any collaboration between the medtech industry, the academia, and even the healthcare providers. So, when we talk about innovation, maybe there are innovations happening in universities, colleges, and we have seen that IITs or whether Institute of Sciences or other reputed institutions or even NIPERs, they have done some innovation in medtech, but they haven't been commercialized because they don't have partnership with the industry. Even on the academia front, when we look at doctors who've been engaged in research in many hospitals, they even can't get their product commercialized. So I think there has to be a platform created, maybe an exchange, an IP exchange, or a common platform where everybody can share an information, and through that platform, companies, academia and institutions should be connected together, and they can freely share information, and that will help to commercialize these products very quickly, and also maybe reduce the cost of manufacturing in the country, because there is so much industrial engineering information available with the companies, but it's not been rightly utilized. So I think if everybody comes together, all three come together, I think there will be a great advantage for medtech industry in India. On innovation front, I think India, if you look compared with China or US or the developed world, the number of patents filed are very, very low from India today, and most of the patents filed in India by multinational companies. So I think Indian companies should be encouraged for innovation. The R&D benefits which were earlier available have been withdrawn. So I would again request the government to reinstate those R&D benefits so that companies are encouraged for innovation. They file patents, even patent fees which is paid in India and overseas, partly if it is reimbursed, it will remove the burden from MSME sector, and probably they will be encouraged to invest in new technologies and innovate. And I think government has taken a very clear path where they want to open the wellness centers. I think in various speeches I've heard in last 1 to 2 years, the Prime Minister has talked about wellness centers, and about 1,25,000 wellness centers have to be opened in India. So if government goes with this plan of opening wellness centers, then I think every district in India will have around 20 to 30 wellness centers, or even every taluka or every village will have wellness centers, because we are talking of large numbers here. And with that number, I think disease like what we are seeing right now, pandemics like COVID and other communicable diseases, the burden can be greatly reduced if we can screen people upfront and take care of the ailments much in advance.